Isabella Villa Real Seabra, welcome. It is such a privilege to have you with us today.
Thank you. It is a privilege to be here. So my journey into reproductive justice was shaped both by personal experience with reproductive healthcare and by the mentors who taught me to view the world through the lens of human rights. So I grew up between Brazil and the United States. So I've been witnessing firsthand how inequities in healthcare access, especially for women and marginalized communities, they're not accidents, they're a result of systemic barriers. So my abortion experience was another pivotal moment for me, transformed my perspective and grounded me in the power of storytelling and advocacy. But for me, transnational and national human rights framework, they shape reproductive justice because they establish accountability mechanisms. And that link both health outcomes to human rights obligations. So for example, we have international treaties like CEDAW and ICESCR.
Welcome to another episode of our Global Health interview series by 72 Dragons Health, a branch of the global production company 72 Dragons, focused on health and wellness. Through this platform, we connect with healthcare leaders across the globe to share their insights, journeys, and the impact they are making in their communities. Communities, countries, and ultimately the world are only as strong as the health of their women. Michelle Obama. Today, we're truly honored to welcome Isabella Villa Real Seabra, whose work and research bring to life the very essence of Michelle Obama's words. Isabella Villa Real Seabra is a passionate organizer and researcher, deeply committed to advancing equitable access to reproductive health care. At the heart of her work lies the intersection of reproductive justice and public health, where she champions policies that uphold bodily autonomy and individual freedoms. Currently at CUNY School of Public Health, she's pursuing her Master of Public Health as a first-year student while serving as the president of the School of Public Health Repro Club. She also serves as the student liaison in the Sexual and Reproductive Health section of the American Public Health Association, APHA. We're excited to hear more about her journey, her research, and her vision for the future of reproductive justice and public health. Isabella Villa Real Seabra, welcome. It is such a privilege to have you with us today.
Thank you. It is a privilege to be here.
Isabella, your work centers on reproductive justice and human rights. What personal experiences or influential individuals inspired and guided you most of this journey?
Yes, so my journey into reproductive justice was shaped both by personal experience with reproductive healthcare and by the mentors who taught me to view the world through the lens of human rights. So I grew up between Brazil and the United States. So I've been witnessing firsthand how inequities in healthcare access, especially for women and marginalized communities, they're not accidents, they're a result of systemic barriers. So my abortion experience was another pivotal moment for me, transformed my perspective and grounded me in the power of storytelling and advocacy. I've also had the privilege of being deeply influenced by amazing mentors. So I've had more recently Loretta Ross, Dr. Helen Rodriguez Trias, who model how to connect community care with legal and policy frameworks. I've also had the mentorship of current provost of CUNY SPH, who is Dr. Terry McGovern, who is an amazing mentor and has been deeply influential in my journey. So their legacies and their current work remind me a lot of how reproductive justice is not about just health service. It is about dignity, autonomy, and equity. And that deeply shapes my work and the way I view the world.
Thank you for sharing. You mentioned storytelling. Can you share what it has been like to be an abortion storyteller with We Testify and Youth Testify? In what ways do you think your voice empowers young women who hear your story?
So, being an abortion storyteller with both We Testify and Youth Testify, which is a combination of We Testify and Advocates for Youth, has been empowering and humbling. So, sharing my story publicly, I think, I've learned has a big role on dismantling stigma while also creating space for others, especially young people who are usually not centered in a lot of conversations. So to see themselves reflected in the movement, which can be a restrictive movement, reproductive justice can be a hard to enter movement. So I believe my voice resonates because I frame abortion not just as an isolated event, but as part of a broader struggle for health and dignity, and also as a normal part of life. So when young women hear my story, often what I've seen is them expressing that it makes them feel less alone and more confident in claiming their decisions as their own without shame. So for me, that's a reminder that storytelling is both personal and political. So it builds solidarity with pushing policy and culture toward justice. And personally, being a storyteller has been a breath of life into organizing, into a work that can be so draining sometimes. Storytelling has been, the community is just amazing and has been truly a blessing to be part of.
Thank you. So you mentioned the United States and Brazil. So you have an experience at a global level. In your view, how do transnational and national human rights law shape reproductive justice and public health? On a global level, where do you see the strongest intersections between public health and reproductive justice?
Yes. So this was a more complicated answer for me, thinking more broadly, because it's not based on just my personal experience. But for me, transnational and national human rights framework, they shape reproductive justice because they establish accountability mechanisms. And that link both health outcomes to human rights obligations. So, for example, we have international treaties like CEDAW and ICESCR that recognize the right to health, which after different treaties, they include reproductive autonomy. They include the right, sexual and reproductive rights. While national constitutions and court decisions will define how these rights are implemented, or especially in reproductive health care, are restricted around the world. On a global level, I see that the strongest intersections between public health and reproductive justice in areas such as maternal mortality, abortion access, and the fight against gender-based violence. So public health is amazing in so many ways. I'm passionate about it, but it's amazing in so many ways because it provides the data and tools to demonstrate those inequities, while human rights law provides the frameworks to demand accountability from governments. Together, they make a powerful case for structural change, and something about it is that reproductive justice at its core, at its foundation, is based on human rights. It is a human rights way of viewing the world, of viewing movements. So they're interconnected at its core.
You are pursuing a Master of Public Health degree. You also serve as a student liaison in the Sexual and Reproductive Health section of the American Public Health Association. How do you balance both responsibilities, and what keeps you motivated and inspired through such a busy schedule?
Yeah, so along with that, I volunteer with 5 organizations, and it's a lot. So balancing grad school and advocacy roles, it requires a bit of discipline, but it also fuels my motivation in a way, being able to join such spaces. So I try to approach it with intentional time management. So treating each responsibility not as separate, but as interconnected. So I try to connect both things I'm doing. So like while I'm doing things in school, I'm like, oh, maybe this could be something for APHA. While I'm learning something in APHA, I'm like, this could be a topic for my paper. So I try to keep my organizing and professional experiences together to bring real world perspective into my academic work. And what keeps me inspired? Oh, so many things keep me inspired. I like to think. But I think mainly is the community I'm part of. I mentioned reproductive justice can be a hard to enter community, but once you're in, it is just amazing. Everyone I talk to, I get impressed. And the community of peers and mentors I collaborate with, that includes the students, because I have amazing students here at CUNY, advocates, and public health professionals who share a vision of reproductive justice, is just amazing. So I often remind myself that my busy schedule, it's actually a very lucky thing. It's a reflection of the privilege I have and opportunity to be able to learn, contribute, and serve a bigger community and a bigger movement than myself.
Amazing. As a young advocate yourself, what advice would you give to someone just beginning their journey in reproductive justice and public health?
Okay, so my biggest advice, I think, is to start by listening, especially to those most impacted by inequities. As someone that is in public health and community health and reproductive justice, one of the biggest roles we have is listening to our community and understanding what their needs are, rather than assuming what they are and going to a community and just implementing things we think they need. So listening is such an important skill to foster. And that is also true for mentors. Like sometimes, even if you're on a coffee break with someone, you might learn so much. You might learn about their life, how their journey guided them. And for me, that's truly so important. So reproductive justice, it's as a storyteller, as we talked about, it is about centering lived experience. It is about centering those most impacted. And so no amount of legal theory or public health data can replace that contact, can replace that community voice experience. I would also encourage new advocates to find their own entry point, which can be hard, but we all have such amazing different skills that sometimes you think that, oh, I'm good at this and this has no place, but truly it has a place. If you're really good at it and if you're passionate about it, it has a place. Sometimes it's just about connecting with someone, and that might open so many doors for you. So for some, it might be through research. For others, the storytelling, organizing might be their path into reproductive justice and public health. But there is no right path. I think every path is valid, and the movement, especially right now, definitely needs all of us. And finally, I think this is something I learned in this past 6 years in the movement, is that we need sustainability. The movement needs to be constantly taking care of itself while taking care of others. So advocacy, organizing, it can be emotionally taxing. It can be a lot. So caring for yourself while caring for your community is part of the work. So for example, I do have a very busy schedule, but I try to always make sure I have space to talk to family, to my dogs. I love dogs. So I try to make sure I always have space for that. And once I had a mentor who said that we fight for the world we want to live in, and that includes how we take care of ourselves and each other along the way. So I think that's one of the most important things too.
Great advice. Thank you. Isabella, thank you for sharing your journey with us. Your work in reproductive justice and your career path serves as an inspiration for young women pursuing studies in public health, and we at 72 Dragons are grateful to witness your achievements and journey. Thank you.
Thank you so much for the opportunity. It's been great.
Now, what does reproductive justice mean to you? Drop your thoughts in the comments below, and let's keep the conversation going. And do not forget to hit the like button. Subscribe to our channel for more such powerful stories from public health voices. Wishing you all well, take care, stay inspired.